In this video, we'll be talking about instructions for the brow lift procedure. There's several different ways to do a brow lift. The most common that we do here are the trichophytic, coronal, and transpalpebral. The trichophytic brow lift is an incision about 3 to 4 hairs back, goes across the forehead, and it does wing into the temple area. That's what allows us to get all aspects of the brow up where we want it. The coronal is at the apex of the head, so in the middle of the head, and it does extend down to the side. The transpalpebral is actually through the upper eyelid. So he makes an incision in the upper eyelid, threads a suture or a suspension system, and tacks that eyebrow up in a more elevated position. Depending on your circumstances and your hairline, Dr. Standifer would have already picked which one is best for you. I also want to make sure that everybody understands why we do Dysport or Botox with our brow lifts. Dysport and Botox relax the muscles for about 3 months. It takes 3 months for the brow to fully set where we want it. So if we can keep you from overworking those muscles while you're healing, you're going to get a better result. Okay, so as with all of our procedures, ice is very important the first 3 to 4 days. We will give you an ice wrap that has pockets, so you can put gel packs, Ziploc bags of ice, whatever you have that's cold and can fit in here is fine. You will have this going around your brow like this. The first night, your caretaker is going to be responsible for changing your ice about every 2 hours. The next day, we can switch to more of a 20 minutes on, 40 minutes off system. You will also sleep elevated, so head above the heart. That allows gravity to do its job and pull the swelling downward. If you lay down flat, the swelling has nowhere to go and it will stay right where it is. This is a different amount of time for everybody, but I tell people to plan on 2 or so weeks of sleeping elevated. We will send you home with a supply bag that has everything you need to care for your incisions. We will give you sterile water, sterile gauze, Q-tips, ointments, all kinds of things. You don't need any of those things until we see you the next day at your follow-up appointment. And we will give you copies of those appointments with the dates and times, as well as copies of all of these instructions I'm going through. If you are only doing a brow lift, you can eat whatever you'd like. As long as you feel up to it, you can eat it. But do avoid excess salt. Salt makes swelling worse. So be mindful of those canned soups, processed foods. You may want to get the low sodium variety. You can shower anytime after we see you the next day. It is totally fine to wash your hair. It is totally fine to get your incisions wet. You won't hurt anything. If you feel dizzy, lightheaded, or just not up to it, wait another day. Some things that are normal. With all of our procedures, people tend to feel worse before they get better. That usually happens around day 4 and 5. You may feel physically worse with more swelling, just kind of dragging, but most of it is emotional. You're going to have feelings of, why did I do this? This is not what I expected. I'm not healing. All of these things are going to run through your mind, and that's very normal. I tell people we have to trust that our body is healing even if we can't see it. Don't check the mirror every hour and expect to see changes. There won't be any. It's more of a day-by-day, week-by-week process. With the brow lift, the swelling that starts up here, gravity gets a hold of it and it tends to stop right here around the eyes. So don't be surprised if your eyelids are swollen and or bruised. That is normal. Mild swelling and bruising lasting over 2 weeks, normal. At that point, you can wear makeup, wear your hair differently, wear eyeglasses. There are several things you can do to help camouflage any residual healing. Some things not to do: no exercise for 2 weeks. We don't want to increase the heart rate or the blood pressure. You can do light things around the house. You can walk gently, but nothing strenuous. It's also very common with the brow lift to have numbness on the scalp that lasts even 6 to 12 months. That's a very common thing. It's a little bit annoying, but it is part of the process, and eventually over time, the sensation will come back. Of course, if you have any signs of infection, like something's really red, something feels hot, you have pus or a fever, call us. I tell people the easiest way to prevent infection is common sense. Wash your hands frequently. Use clean pillowcases, clean towels. If everything's nice and clean, we will drastically reduce that risk of infection. That's all for the brow lift. Of course, if you have any questions, you are more than welcome to ask, and you will get copies of everything, and feel free to watch this video again if needed. See you soon.